Distinguished guests, ladies and gentlemen, greetings. I thank the United Nations Global Compact for this invitation to address the opening of this event on building resilient healthcare infrastructure for sustainable recovery through public and private partnerships. The impact of the COVID-19 pandemic is all too clear, as it has disrupted everything from our daily routines, mental health, and overall well-being to the operations of businesses and supply chains throughout the world. But even as we address this crisis, we can also learn important lessons from it that can lead us to a more sustainable future. Indeed, learning these lessons is critically important. With it, we can take the transformational steps needed to protect ourselves, our businesses, and our planet from future pandemics and other serious threats. At the same time, we all, as governments, businesses, civil society, non-governmental organizations, and individual citizens, should keep doing what we can to slow the spread of the virus and mitigate its impact. We have a collective responsibility to ease the harm inflicted by the pandemic, especially for those in poor and vulnerable communities that have suffered disproportionately. COVID-19 has cast a glaring spotlight on the urgent need to build a more sustainable and resilient healthcare infrastructure around the world. This means strengthening the crucial building blocks of healthcare defined by the World Health Organization, from service delivery to technology to governance, in order to achieve the goal of universal health coverage. While healthcare infrastructure is a concern everywhere, the greatest needs are in developing countries. Spurred on by the pandemic, we can bridge global gaps in healthcare infrastructure through the promotion of global partnerships. According to the World Health Organization, investing in and scaling up primary healthcare interventions across low and middle income countries could save 60 million lives and increase average life expectancy by 3.7 years by 2030. We must address these intolerable health inequities and advance the Sustainable Development Goals more broadly so that no one is left behind. Ladies and gentlemen, the COVID-19 pandemic has highlighted the profound need for a spirit of collaboration that prioritizes people over profits and that recognizes that we are stronger when we work to lift not just ourselves, but the most vulnerable amongst us. The COVID-19 pandemic provided us with many examples of how people and societies can adopt new behaviors when the challenges and priorities are clearly set out by governments. The emergence of the COVID-19 pandemic has also exposed the inadequacies of many health systems and highlighted the urgency of achieving universal health coverage. It has also highlighted the urgency of digital cooperation and demonstrated the interconnectedness of our challenges. In this context, the business community can and should play a critical role in improving healthcare infrastructure. Most significantly, this effort gives companies a chance to make tangible contributions towards realizing the Sustainable Development Goals. It also offers unique opportunities for them to grow into new markets by providing desperately needed innovations in technology and services and products, all in a responsible manner aligned with the 10 principles that guide the work of the United Nations Global Compact. In addition, we must redouble our efforts in creating impactful public-private partnerships through which we can build sustainable and resilient healthcare infrastructure with dynamic, effective collaborations and robust financing. Investing in building resilient healthcare infrastructure requires international cooperation and partnerships, particularly supporting developing countries. This can occur through emerging and innovative collaborative frameworks, along with the efforts of all sectors of our society, including governments at every level, the private sector, civil society, academia, young people, to leverage their much needed resources and innovations. To pave the way forward for the world we all want tomorrow, we must make the right investments today. As I recall, at the beginning of the COVID-19 pandemic, the United Nations Global Compact Action Platform on Sustainable Infrastructure for the Belt and Road Initiative to accelerate the SDGs released its first white paper. It featured multiple examples and case studies showing how businesses can work together, invest responsibly, and deliver solutions to pressing healthcare challenges while ensuring their own longevity. This document offers a starting point for this much needed discussion and lays a solid foundation for action in the years ahead. 2 years have passed since the Action Platform's publication, and I'm sure we have all learned new lessons that have valuable examples to share that can build on the ideas of this publication. I look forward to new thoughts and inspiration, not just on COVID-19 recovery, but also in the construction of a more sustainable and inclusive health systems. I also look forward to working with companies, governments, and all stakeholders to build their healthier and a more sustainable future. If we succeed, future generations will remember our current difficulties as a distant crisis that was, nevertheless, a turning point for global progress. The United Nations in China stands ready to work with all stakeholders to usher in a new spirit of multilateralism, to facilitate future cooperation on building resilient healthcare infrastructure through offering its support and network, as well as working closely with the government of China, academia, and other partners to advance the 2030 Agenda and the Sustainable Development Goals. Ladies and gentlemen, this year also marks the Year of the Rabbit, a time for prosperity, progress, and peace. I wish you all and your loved ones the very best for a happy Chinese and a happy Lunar New Year. I wish you fruitful discussions. Thank you.